billahi minash shaitanir rajeem, bismillahir rahmanir rahim. So this session is on complementary and alternative medicine. To introduce myself, Irfan Alladin. I'm a physiatrist, board certified physiatrist. I do physical medicine and rehabilitation. And this is a field which is closest linked among the specialties of medicine to complementary and alternative medicine. We actually do discussions on chiropractic within our residency program. We learn about acupuncture within our residency program. So, and of course we do physical therapy, and even discuss homeopathic medicine, herbal medication, and nutrition, and even Ayurvedic medication as part of our residency training. So in physiatry, there's a very strong emphasis on using allopathic medicine only when needed, or using as in terms of complementary medicine, using this alternative medicine to supplement the allopathic medicine. So even though I have to admit I spend most of my day doing injections, interventional pain management, the transforaminal nerve blocks, medial branch blocks, and radiofrequency ablation, discography, microdiscectomy, and facet fusions, we do the training and so on. Because I think we have the very big anesthesiology pain doctors there, Dr. Sakib and Dr. Kudus, coming from anesthesia pain, I, as a physiatry pain, physical medicine pain, am kind of pushed into the alternative medicine, but we do both. So I actually enjoy doing the acupuncture and the complementary medicine, even though I have the fellowship training in interventional pain, because this is for those patients who don't want to take allopathic medicine. They don't want to take, whether it's Percocet or Vicodin or Dilaudid. They also don't even want to take ibuprofen. They don't even want to take cyclobenzaprine. For those patients, this is great. And also you have patients who don't want a transforaminal block, and they definitely don't want a discectomy or translumbar interbody fusion and so on. For those patients, this is a great alternative, or many alternatives. So that is some of what we do in physical medicine rehabilitation, and we work as allies with chiropractic here, and Dr. Talha will come, and Dr. Samara as well, for the homeopathic. But like I said, my own training is in physical medicine rehabilitation, pain management, pain medicine, and also manual medicine. We do manipulation under anesthesia for those patients as well. And I would begin with certification and also buprenorphine and naloxone. We do detoxification when the opioids do tend to be a problem, or patients who want to avoid opioids, but they like to take the buprenorphine, and we'll discuss that in the next hour at 3:30, inshallah. But regarding acupuncture, we'll begin. The first here is, so acupuncture is based on a concept of qi. Qi is an energy that we have within us, and this is the traditional Chinese medicine. We'll discuss that. And the qi flows throughout the body, almost like in superhighways. And when there's a deficiency of qi, that is a yin, and when you have yang, you have too much qi. So it is this balance that we try to maintain that is the basis of acupuncture, is maintaining the qi. When it's low, you increase it. When it's high, you decrease it. You know the yin and yang symbol, the white within the black and the black within the white. Every bit of yang, even if there's a lot of yang, you still have a little bit of yin. If there's a lot of yin, there's still a little bit of yang. The idea is to make it balanced in order to treat pain, in order to treat all forms of disease, and we'll go through some of those. And this is studied also by NCAM, which is the National Center for Complementary and Alternative Medicine. So qi, as I mentioned, is that superhighway. There are 12 meridians. These meridians are not based on any anatomic channels, anatomy that we have studied in allopathic medicine, whether you studied in chiropractic or allopathic medical school, osteopathic medicine. These are totally different. There is a stomach channel, a colon channel, a heart channel, and intestines, spleen, kidney. These are all the 12 primary meridians. But if you look at the lines you see in the different colors, they don't follow any anatomic pattern that we study in medicine. This is traditional Chinese medicine. And the Chinese diagnosis is also separate. In the Chinese diagnosis, the traditional Chinese medicine, It is that it take a detailed history, but the history often relates not just to symptoms, but to a patient's understanding of their own disease process, and also the living habits and the conditions of the patient, as well as the personality of the patient. And we see this and we'll discuss how we bring these together, the chiropractic, the homeopathy, and the acupuncture. We know that in homeopathy, they often discuss this as well, that if a patient has a nux vomica type of personality or a pulsatile personality, the medication and the treatment is different. Also, in Chinese diagnosis, we look at the tongue. We look at the odor of the breath. We look at the pulse, the face, and the chest, the rising and falling of the chest, inspiration and expiration, in much greater detail often than allopathic medicine. If you see that the tongue is red, that is excess heat, a lot of yang, which means yang means white, light, summer, loud. Think of a young boy running around. That's a lot of yang and very little yin. In contrast, you have the pale tongue. The pale tongue is a deficiency of qi. Excess qi is red. The pale tongue is a deficiency of qi. Think of the winter time, black, dark, cool, quiet. Think of the old lady who just wants to be left alone. That's high yin, low yang. Then there's the pulse. The pulse is interesting. It's measured at a superficial level, a middle level, and a deep level. And similarly, there's a distal pulse, a middle pulse, and a proximal pulse. But the area where the pulse is taken is the same as our radial pulse. But the Chinese medicine, the TCM, the traditional Chinese medicine, gets 9 pulses where we get just 1. I'm not even talking about getting an ulnar pulse. The radial pulse has 9 different locations, and if you take a course in acupuncture, you will learn how to do 9 assessments just of the radial pulse. This is the guide, as I mentioned, of the pulses and the positions, and this is the personality types that I mentioned. So summer, as you see, is a fire. That's summer. It's fire, red. It's a bitter taste, but the emotion is happy. That's the young kid out in the young boy running around. And then the cool is the water personality, cold, and it's a black color, salty taste, tears and emotion. And then in between you have earth, metal, and wood. These are 5 types. And I contrasted it here on the right side with the homeopathic. There you have the 4 personality types in homeopathic medicine. Definition of acupuncture. Now when you move into acupuncture, we find that this is acupuncture attempts to modify the qi by inserting needles at specific points along the meridians, as I described. If you turn clockwise, you increase the qi. If you turn counterclockwise the needle, you decrease the qi. And if you apply moxa, you might have seen those heat sticks, that increases qi. Others use suction, and suction decreases the qi. So it depends what modality, turning clockwise, counterclockwise with a needle, and then whether you want to use moxa. If they have too much qi, they would use the suction to pull it out. If they have too little qi, you take the moxa and the heat to increase the qi. So this is how that is done. It is over 2,000 years old. It's interesting, sometimes the insurances try to deny its treatment for acupuncture, saying it's experimental. So I laugh at that because they say it's 2,000 years old, but it's still experimental. And that's because they don't want to pay for it. And then French ear acupuncture, you may have seen the ear acupuncture. The entire 12 meridians that I showed you before for the body are represented again in the tongue, in the tongue and the ear. So the ear has all of the same meridians displayed in a different pattern as it's shown in this diagram. And as well, you can use the ear acupuncture. The entire acupuncture can be performed on the ear. So if you have a patient with first-degree burns, second-degree burns, and you can't use most of the body to place the needles, if the ear is saved, you can do the entire acupuncture treatment, just with the ear. And that's the French ear acupuncture. Risks of acupuncture are exceedingly low: soreness, bleeding, bruising, infection, organ injury, and usually not serious. So it's a very low-risk treatment. Why choose acupuncture? More and more people want to stay away from the pain medication and even injections and surgeries and use alternative means. And that's the way medicine is trying to move, or people are trying to move. Acupuncture is a popular alternative. It's not just for pain, headaches, migraines, but it's a great adjunct in treatment of cancer, chemotherapy, complications due to chemotherapy, such as nausea and vomiting, or side effects of chemotherapy, fibromyalgia. I had a study here showing that for patients with post-episiotomy, they gave Percocet and the Vicodin, but if you add the acupuncture, the need for those medications drops precipitously. Also used in pediatrics, where you have the number of hours that the baby is crying with colicky pain. This is peds gastroenterology from my brother, Dr. Sohail. Here, the number of hours is decreased in the amount of crying, the number of hours when the baby is crying, to a statistically significant amount, I think over 30%, just with the use of acupuncture. And can be used for treatment of fertility. Again, at 6 months, 30-40% increase in fertility. So Parkinson's, with acupuncture, the patients were found to have greater balance, better balance control, more rapid and more stable gait, and increased stride length with ambulation, all with acupuncture. Also for mental health, depression, stress, and anxiety, acupuncture has benefit. I mentioned with the chemotherapy, nausea and vomiting, acupuncture is a great adjunct. Decreases the need for the ondansetron and the Zofran. So as far as the National Council of the National Center for Complementary Alternative Medicine, these are tying all these together. They're doing studies, and they have some evidence now that post-dental surgery, if the patients who received the acupuncture didn't need any of the opioids. They just had the acupuncture. So against placebo, it was a statistically significant improvement. Older patients, they gave the traditional medication, but did not have to escalate the dosages because they used acupuncture in the treatment of osteoarthritis. Synergies with chiropractic. If you do the acupuncture, particularly the electroacupuncture, what we call the deep acupuncture, when the needle is attached to an electrical stimulation, the stimulation goes deep into the muscle. And when you put it into the paraspinals, the lumbar paraspinals, it shows a marked decrease in spasm. So when Dr. Talha would go to do the adjustment, the back, which was hard like a rock, full of spasm, the lumbar paraspinals, now they're eased. And this is the result of electroacupuncture, where you attach a TENS type unit to the acupuncture, much greater than a TENS unit placed on the skin. Synergies as well, it can treat for migraines along with the chiropractic and osteoarthritis and cervical and shoulder pain. And some other similarities with homeopathy. You know, in homeopathy they say, oh, दूध नहीं पीना. Don't give them milk because when they have allergies, asthma, upper respiratory infections, the milk will increase the mucus production, yogurt, ice cream, all of these dairy products. So the same is in the acupuncture. It teaches the same thing. In the same way also, in terms of cold water, avoid ice water. This is taught in the homeopathic. It's also in the acupuncture. Avoid the cold water. We remember one time Hazrat Rabi said that this water you've given me is not even lukewarm. Please get me the hot water. That same hot water that we're advised to take in homeopathic is also in the acupuncture. And we finished up here with the homeopuncture. And this is the epitome of the complementary and alternative medicine, bringing it all together. We take the acupuncture needles and dip it in the mother tincture, whether it's a Nux vomica, pulsatilla, calc phos, whichever credigus, whichever mother tinctures you have, dip it in there that are appropriate for the patient, and then put the needles in the appropriate acupuncture points. They get the benefit of homeopathic along with the acupuncture with synergistic benefit. And if it is a pain diagnosis or even other diagnoses, organic, you have Dr. Talha do the adjustment on them, and then they get the chiropractic too, that's triple. So Mela enables us to do all of these together, and I'll introduce, bring on Dr. Talha.